Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
Hello, everyone. My name is Valerie Marcellus. I am a registered dietitian and a certified specialist in oncology nutrition. And I am going to be presenting today for the Cancer Support Community Atlanta. A little bit about my background. I worked as an oncology dietitian, and I am now working in the diabetes space. And so I'm excited to talk to you all about that overlap of managing blood sugar through nutrition. Here are the objectives I'll be covering today. We're going to discuss factors that contribute to high blood sugars, explore tips on improving blood glucose levels. You'll hear me say blood glucose and blood sugars interchangeably throughout the presentation. We're also going to go over label reading, what you're looking for when you're checking food labels, and identifying resources for planning balanced meals and snacks. So I like to start with being on the same page about what causes high blood sugars. There are lots of different reasons why some people's blood sugars tend to be high, but the most common reasons are disorders of glucose metabolism, such as diabetes. When we are thinking about cancer treatments, some of the medications used in cancer treatments also can contribute to high blood sugars. And even some of the medications used after active cancer treatment, during recovery, during survivorship, can cause high blood sugars. And then there is this issue of insulin resistance that also contributes to high blood sugars. And this is an image that is showing what is happening with insulin resistance, the process that takes place in cases where people have prediabetes or type 2 diabetes. The candy bar represents a carbohydrate. So the very first step, we are going to take a bite of food. And once we take that bite of food, the digestion starts in the mouth. We have enzymes in our mouth that break down the starches into sugar. And the food progresses to our digestive system, where our stomach breaks it down further. And when the sugar molecules are absorbed into the bloodstream at the small intestine, that's kind of where we start seeing the difference when insulin resistance is an issue. This set of keys represents insulin because normally the next step in the process would be for insulin to be the key that's opening the door of our cells to allow the sugar into the cells. But what happens in the case of insulin resistance is that you have the key, but as you can see, the door is not opening, or it's not opening all the way. So some of that sugar is going to stay in the bloodstream. In type 1 diabetes, oftentimes people call this insulin-dependent diabetes because the issue there is that there is no key. And so depending on the type of cancer, especially if the pancreas is impacted, people may have to take insulin with meals because the body is not making enough or not making any at all. All right, so when it comes to high blood sugars, this is a big problem because if the blood sugars are not the level they're supposed to be, one, you're not going to feel very good. But also, having high blood sugars for long periods of time can damage blood vessels. It can cause damage to nerves. Sometimes part of cancer treatment may be having a surgery, having some type of operation. So we know when blood sugars are very high, wound healing can be slower. Fatigue is already a common symptom of cancer and cancer treatment. One of the hallmark symptoms of high blood sugars is also fatigue. And then when it comes to cancer treatment, if blood sugars are too high, um, sometimes that can cause delays in treatment. And so, what are some things that put people at risk for diabetes, at risk for higher blood sugars? Age. The older we get, the higher our diabetes risk becomes. Also, demographics in terms of different populations have higher risk of developing diabetes. We often see high blood pressure and high blood sugars together. There's big genetic components, and we can't do anything about our genes, but it's good to know if you have that risk factor so that you can be looking out for how your blood sugars are doing. Physical activity. Having regular physical activity really really improves overall health and reduces the risk of a lot of different conditions and can be a big part of managing blood sugars. And then weight status as well. So these are all diabetes risk factors. And when we look at those diabetes risk factors, there were some on that list that we can control, some that we cannot. So the things we can control, we call those modifiable risk factors. And some tips for reducing risk of diabetes are, of course, attending your regular medical visits. If your doctors see your blood sugars creeping up, they can help you address that. Dietary changes tend to be very important because that can be a very accessible change. You don't have to wait for a prescription to start making dietary changes. Exercise, also something that can be very accessible for a lot of people that can help with controlling blood sugar levels. And then if you do have some of these other conditions that tend to increase risk for diabetes, making sure that those are under control as well. So doing what you need to do to manage your blood pressure, manage stress, getting adequate sleep. And so I'm going to talk about managing high blood sugars both in survivorship and in active treatment. And you will notice that the information is very similar for both. And so when we're looking at survivorship, we want you to be managing your blood glucose levels. The image that I have here is somebody using a blood glucose meter. Some people are monitoring with continuous glucose monitors. That is fine as well. The point is that if we do not know the number, we cannot treat the glucose. So having some way of monitoring your blood glucose levels is going to be an important part of management. Also, hydration is very important. Oftentimes, we see people come in with very high blood sugars, and the first thing that we want to do is get them hydrated. And so that's something that you can be intentional about on your end. Increasing physical activity as you're able to, as you are cleared by your physician to do so, helps with lowering blood sugar levels. And one thing we're going to talk a lot about is eating foods from all of the food groups. So there's always a lot of different dietary information, but we find that when you are avoiding an entire group of foods, you're not just missing out on the sugar that may be in some of those foods, but all of the other nutrients that would have been in those foods. And so during active treatment, just like in survivorship, we want you monitoring your blood glucose levels. But active treatment has a lot of moving parts. And so If pricking every day feels like too big of a burden, maybe talking to your physician about a continuous glucose monitor can be an option that lifts some of that burden instead of not checking at all. Also, working with your doctor to develop a sick day plan is really important because we're going to spend a lot of time talking about the dietary recommendations and what is recommended to do most of the time, but that's most of the time as you're able. When you're really sick and it's really hard to eat, we just want you to eat what you can tolerate and prioritize hydration and also continue checking your glucose levels more often. For a lot of people, maybe you already had diabetes before your cancer diagnosis, and your diabetes has always been stable, well managed, but things change when you have this different level of stress and you have these different medications. There's nothing wrong with discussing getting a referral to a specialist if your current management is not working for you. And then also, just like the other slide, staying hydrated, exercising as you're able to, and eating foods from all of the food. So, why do we even bother making dietary changes with the rising costs of food? Medication still costs more than food. And the long-term cost of not making changes is higher. There's data that explores the cost of diabetes as it pertains to time taken off work, out-of-pocket medical costs. And so dietary changes are very helpful, and they can make a pretty big difference in a short period of time. Also, you have to eat, so the idea is making sure the meals you're having are providing you with your health benefits as well. And just some practical tips. Um, I'd like you to think before you're even thinking about what should I have on my plate, we have to make sure you have it at your house. And so making sure that you're taking some time to plan before your grocery trips can be very helpful when it comes to your success in sticking to your dietary changes. You'll want to first assess what you already have at home, do a quick little inventory, which can be as simple or as complicated as you would like it to be. It could be a glance over when you open all of the cabinet doors, or some people use like an app that keeps track of what they have at home. When it comes to planning your grocery trip, you also want to kind of think about what do you want to eat for the week ahead and make a grocery list. Again, making your grocery list can be as simple or as complicated as you would like it to be. So you can use electronic tools. You can just write yourself a little list on a sticky note. Both are very effective. But if you go in with a plan, at least you will have the things that you need at home. When you're planning your grocery trip, if you aren't already, we definitely want you to add fruits and vegetables that you enjoy to your grocery list. And also think about which foods are in season because they tend to taste better and the prices tend to be better. When it comes to saving at the grocery store, they have what are called unit prices that will be listed next to the price of the item. So if you're not already comparing unit prices, that is another tip that can help you with saving at the store, because instead of just showing you the total price of the package, it shows you the cost for a specific measurement, such as the cost per ounce, as you can see in the example on this slide. And so that can really help you to determine how you're getting the best deal. Also, if you have staple items that you always get, staple items that have a long shelf life, buying them in bulk can save you a lot of money at the store as well. And then when it comes to retail prices, comparing and trying out different brands is great. Sometimes a generic brand tastes better and has a better nutrition profile that's more closely aligned with your health goals. So it's good to explore different brands when you're looking to save and also when you're looking to make changes. All right. And then making plants the star of your meals is going to always be a recommendation when it comes to a healthful diet. So the American Diabetes Association and the American Heart Association, as well as the American Academy of Cancer Research, all of those have in common proposing having plenty of plants on your plate. And when you're making your meals at home, just starting with making sure that you have one of your sides being a plant food, a fruit, a vegetable, some beans, that's a good place to start. So the plate method is the visual example that we like to use when it comes to making sure you have enough plants on your plate. Ideally, we like you to fill up half of your plate with non-starchy vegetables. And the plate method is just another example of a dietary pattern that focuses on adding fruits, vegetables, whole grains, and lean protein for balanced meals, as well as being mindful of the portion sizes of the different foods. When it comes to saving at home, one of the big things we don't want to do is take all this time to plan our grocery trip and make our grocery list and then forget we have the food and throw it out because it went bad. So storing food strategically can be a really important part of saving at home as well. The first in, first out method really helps you to use foods before their expiration dates, because with that method, the oldest options are placed in the front of the cupboard or the front of the pantry so they can be used before they go bad. And so aside from the unit price, another good value to check out on the packaging is always the expiration or the best by dates. A lot of foods will have a use by or freeze by date. And so best by dates are just that. That is the date up to when they can guarantee us a certain level of quality for that food, but it doesn't mean that it is expired if it is past its best by date. Um, if foods are expired, you definitely want to discard those because we want you to be safe. But best by dates are just indicators of peak quality, not of food safety. The other big tip I would give is to make sure the temperature of your refrigerator and freezer are where they are supposed to be, because if your refrigerator is running too warm, then for some reason you're having to throw things out much sooner than you normally would. And then the freezer is your friend, so it is fine to purchase frozen produce. It's fine to freeze fresh produce, fresh meats, and fresh dairy products before they go bad. It's fine to freeze leftover prepared foods, prepared meals. This is going to help you to save money and reduce waste. And so the last item I'm going to go over with you in terms of what we're looking for when trying to have a more balanced diet is label reading. So when you are reading a food label, there are always going to be bolded items. When you're looking at all these different bolded items, from the standpoint of managing blood sugar levels, the serving size is going to be very important, because that is showing you what all of these other numbers, all these other values correspond to. So all of these numbers are for that portion, not for the entire package unless it says that. So the bolded items are good to glance over, but definitely pay close attention to the serving size. And then pay close attention to the total carbohydrate, because the total carbohydrate is the total amount that's going to convert into sugar. And so if for whatever reason, your blood sugars tend to run high, you don't want to have a large amount of carbohydrate in one sitting. Dietary fiber is also important to look at for a few reasons. The dietary fiber is there to kind of help with slowing down the release of sugar into the bloodstream. And then a lot of cancer treatments also have different digestive side effects. And so soluble fiber specifically can really be helpful for side effects related to a lot of cancer treatments. And also insoluble fiber. And then added sugar tells us how much sugar the manufacturers added to the food that may have already naturally had some sugar. So for example, if we make applesauce, there's naturally going to be sugar from the apples. Apples are sweet foods, but then they may also add some sugar too. And so our guideline for added sugar is we like to keep this number in the single digits, because if this is a large number, then it will correspond to blood sugars going up higher faster. And so I do want to leave you with some nutrition information and recipe resources. The American Institute for Cancer Research has healthy recipes on their website. And you'll notice a lot of them are the things that we're talking about, having a lot of plant foods. Northside Diabetes Nutrition and Education Program, we have nurses and registered dietitians that specialize in diabetes that can help you on your journey. Also, recipes.heart.org is the recipe website for the American Heart Association. eatright.org is the website for the Academy of Nutrition and Dietetics. And the American Diabetes Association, their recipe resource is called Diabetes Food Hub. So all of these are great resources, and there's always a lot of good information online. But I wanted to make sure you had some reputable resources as well. Right, and then these are my my sources that I used to come up with the presentation. And I encourage you to check out these websites as well. They have a lot of good information. And so thank you all for joining us for this presentation today.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org. Or follow us on Facebook. We'll be sharing additional information on upcoming programs.